Hi there, I'm Dr. Sue Fessler. I'm one of the pulmonary and critical care physicians here at Logan Health. So lung cancer screening is approved now for people ages 50 to 80, all smokers or recent smokers, meaning if you have quit within the last 15 years. And for those smokers who have more than a 20-pack year history of smoking, and that means take the number of packs per day times the number of years you've smoked and you get a pack year. So if you've smoked more than 20 pack years, that means you've smoked a pack a day times 20 years or 2 packs a day for 10 years. You get the idea. So lung cancer screening is performed using a low-dose CT scan of the chest, and that low dose refers to radiation exposure. As the CT scan technology has improved over the years, we are now able to obtain really accurate images of the lungs using less radiation than a traditional CT scan. As such, patients will be coming to our imaging center where they will register and sign in and be taken back by one of our technicians to the CT scan. The scan itself takes only a few minutes. The patients lie on a scanning table. You should wear comfortable clothes. And you may be asked to take deep breaths, hold your breath for a few seconds, but otherwise the scan itself is only a few minutes. Well, lung cancer is currently the leading cause of cancer deaths in America. And part of the reason it's such a major cause of death is that it's often detected very late stage. So symptoms don't develop from lung cancer until the cancer is typically quite advanced, and then our treatment options are very limited. By screening patients regularly, we're able to identify lung cancers at very early stages where the treatment is much more effective, and we have more treatment modalities available to us. Well, smoking is probably our greatest risk factor for lung cancer. It's not the only risk for lung cancer, but certainly we know that after quitting smoking, the risk of lung cancer remains high for an additional 15 years. It's highest when you're actively smoking, but it really takes considerable amount of time after one's quit before your risk is down to the normal population. And that's why we recommend continued screening even after people have quit smoking. Obviously, smoking cessation or smoking prevention are our best tools at preventing future lung cancers. So I think one of the most important things that patients should think about before embarking on lung cancer screening is what are the potential consequences of this scan. And this is a discussion that you should have with your provider. Discussing the pros and the cons. Obviously, we've talked about the pros being early detection of lung cancers when they're at a more treatable stage. But we often will find abnormalities on scans that may or may not have needed to be found. I think patients should be aware that what we call nodules or densities within the lung tissue are very common. About 50% of lung cancer screening patients will have one or more nodules detected. Very few of those turn out to be cancer, but it's important to know going into it that that's a possible outcome. Sometimes those nodules require a follow-up scan in a period of months, sometimes as much as further testing with biopsies. But it is important to recognize that that is a potential outcome. Sometimes we find things that aren't pertaining to the lungs at all, and that can be a good or a good thing or a nuisance, depending on your viewpoint. So just important to go through those potential outcomes with your provider before you get the scan.